Austin's News Radio.
We're delighted to be joined by Dr. Brett Bolton. He's a hair restoration surgeon, and he has a cautionary tale. Dr. Bolton, welcome back to Nightside. How are you, sir?
Hey, thank you so much for having me back. It's great to be here.
So there's a problem. A lot of people, apparently, Turkey, the nation of Turkey, has attracted over 1 million medical tourists last year. And there's now a public advisory on the risks of going to Turkey to get a hair transplant because I guess the prices are significantly less expensive in Turkey, but the results are terrible.
So what's happened is since FUEs came out, I think we were speaking about that last time I was on your program, which was the advent of the puncture biopsy in the donor region where they're getting the donor from, and anybody can basically puncture the holes is what they're doing. So they're able to have technicians do the surgical work. So that exploded in opening up this whole new avenue of transplants. And in the United States, I had mentioned the unlicensed technicians are doing these FUEs. But what happened with Turkey is you have social media influencers that are coming out and they're saying, "Oh, look at me! I'm in Turkey. I got picked up in a limousine. I'm taken to this hotel, and they're having their transplants." And I'm not going to sit here and say that they're all bad because I've happened to see some quality work out of there. But unfortunately, that's not always the case. And I see a lot of the patients that are coming back where they'll have very unnatural looking hairlines, very unnatural growth of the grafts. Patients are having, skin issues. The way they're harvesting the donor, they're depleting it. That technique also causes issues with the blood supply. It causes issues with the nerve supply. It causes what's called fibrotic adhesions, which are the scar tissue. So the patients are lured out there by this fantasy of this, great result when, not everybody is getting that. And they think it's, they're going to get this great deal. And so they go out there because they're, seeing these people and they think, wow, I'm going to get that. Yeah. And then when they don't, then they say, oh boy, well, now what do I do? So then they have to do serious research.
So the number that I see says Turkey has attracted over 1 million medical tourists last year. Does that mean 1 million people from outside of Turkey have gone to Turkey for a hair transplant, or are there other medical procedures that Turkish physicians
they're doing other things than hair transplants for sure. Okay. But so I can't specifically say that it's 1 million for hair transplants.
Right. Any idea how many Americans? I mean, Turkey is a good haul, and obviously people in Turkey. I don't know if English is a second or a third language, but there's got to be some language issues there. Is this being expedited through American companies? I mean, how do you get from America to Turkey and find the person you're going to have a hair transplant with?
That's a great question. And what's happening is, they're searching the web and they're on these chat boards and they're looking on social media and people are making recommendations, but the reality is it doesn't have the same licensing laws obviously that we do in the States. So do you know that it's a credentialed clinic? Do you know who's working on you? Do you know if the office that they're showing the photos is truly the doctor that's producing that work? So there's a lot of questions. And I don't just want to bad rap Turkey because it's not just Turkey, believe it or not. I hear patients flying to Mexico and flying to all sorts of places in South America to get better deals. But the reason Turkey's taken off for hair transplants is basically because of the social media. And that's really what's changed the game, for sure.
Well, I have friends who are Turkish, and they're great people. But like anything else, if you want to be duplicitous, I mean, to do anything in another country, you're functioning under a whole different set of oversights and administrative regulations, which we have here. And even here, surgeries and procedures can go wrong. There are surgeons who make a mistake, and that's why we have medical malpractice here. But if you're gonna go to Turkey, you have to really know who you're dealing with. If you're gonna go anywhere other than, you should always know who you're dealing with. But particularly if you're going overseas, you got to know who you're dealing with, because when they come back to you and say, Dr. Bolton, can you fix this? You can't necessarily fix it if it's been messed up too badly, correct?
So the good news about hair transplants is if they haven't depleted the donor and there's still donor tissue, then there's a high probability I can correct it for them. But the unfortunate thing happens when they have what's called donor depletion, where they're over harvesting the donor area. Then they're running into trouble. So a lot of times, due to the way the technique is, they're taking the donor tissue outside of what's called the safe zone. So kind of envision a bald guy that just has a ring of hair around the back. So the safe zone would be the area in the center, as if it were to drop down, and then it's retrograde as it were to come up. So we want to stay in the center of where that area is not genetically susceptible to the hormone conversion that causes the genetic loss. When they do this procedure with the harvesting they're doing, it's called the follicular extraction, they're having to take outside of the donor area, so that way when they make their punch biopsies, they're not getting them too close to one another, because otherwise the donor hair will look moth-eaten, and it looks very unusual once it's over harvested. So if the patient loses more hair, the hair that they transplanted is susceptible to falling out the same as it would in the back of the head. It has that DNA.
So let me ask you this. You see a lot of things advertised. I saw something, I'm pretty lucky. I've got a full head of hair. I've worked on TV.
I saw you. Look, you're doing great
for a long time. I hope it stays there. My maternal grandfather was blessed with a big shock of white hair when I knew him as a little boy, and I'm told that is where most men get their hairline from. Their maternal.
You're blessed.
I don't know if that's true or not. I hope it is. Let me put it like that. But you see stuff about, you use this shampoo or you use that. They also have a hat that they're selling. I saw it was on one of the CBS stations the other day, that you wear 10 minutes a day. Does any of that stuff work?
Okay, so here I'll tell you what I recommend, and I'll tell you what I know for certain works. Yeah. There's 2 FDA-approved treatments that help prevent future hair loss. Yep. And my challenge daily is talking to a younger patient and say, hey, I'm going to recommend these 2 treatments. You have to consistently do them, and unfortunately you can still lose hair. I mean, that's my everyday uphill battle. Yeah. The number one go-to that we have currently is, the brand name is Propecia, and the ingredient is finasteride. It's generic. It's only, if you shop it right at Costco or Walmart, you can get it maybe $30 for the year or so. And that's a whole year. And I have the patient start off every other day for about a month or so to adjust the body to it. Then it's a pill a day thereafter. Now, they always ask, well, how long do I have to take it? My politically correct answer to respond to them is, as long as you want to keep the hair. That you're trying to save. So once you stop taking the medications, you're going to revert back to wherever you're supposed to be genetically. So you need to stay on it to help keep what you have. So that's my number one most effective way, and that's a pill. Number 2, everybody knows about, it's Rogaine. That came out in the 70s. Back in the day, it was like $400 a month back then. Yeah. And fortunately, it's been out so long, it's generic. And there's two versions. They say female and male Rogaine, or female or male minoxidil. Minoxidil is the ingredient we care about. Yeah. But it's the same product. One's just a lower percentage. The female one's 2%. The male one's 5%. So I start even all my male patients with the female version, the 2%, for about a month or so. That allows their body to adjust to it. You would apply that once in the morning after you shower, once a night before you go to bed. You use that 2% for that month and see how your body responds. As long as you're not having unusual redness or flakiness or something that looks unusual to you on the skin, then it's okay to go up to the 5%. Much easier tolerated. It's a foam. They sell that again extremely inexpensive at like Costco or Walmart. It's like $10 a month or something like that. And these products,
Well, what I'd love to do is have you back and maybe focus on, as opposed to what people shouldn't do, but we could focus on some of this as to what they can do, because a lot of people, men and women, do deal with that problem at some point in their life. You're a great guest, and Dr. Bolton, I enjoyed every time you've been with us, and I enjoyed it tonight. I got to jump off. Unfortunately, I could talk to you all night about this because I think there's a lot of people in my audience who could benefit. Maybe we can have you back and do an hour some night and do phone calls from listeners. Okay, great.
It'd be my pleasure. Anytime. Thank you again for having me.
How can folks get in touch with you? I know that you're not in our neck of the woods, but if someone wants to get in touch with you, what's the easiest way?
Thanks. My patients flying from all over the world. It's great. HairTransplants.com, Dr. Brett Bolton. And thank you again.
My pleasure, Dr. Brett Bolton, greathairtransplants.com.